Thank you, everyone. Thank you for having me here. Can you hear me? Yeah. Okay. Well, I don't have anything ready. I didn't prepare myself for this speech. So this afternoon, when I arrived here, I looked at that and I saw accessing patients. So that what is it then? How can we access patients like me in a world when up until now doctors have seemed to be like this high, while we patients used to be or feel like this low? So that is what all this is about. We not only go to see the doctor because I have a headache or I have pain here or there, or I can go to work and I feel very tired. We are more than patients. We are more than just a couple of symptoms and levels, and you can see in our analysis. And that's what I try to teach people that come to me, to my blog, because nowadays what people need is a lot of information. Times have changed. Like 20 years ago, we didn't need information. Just give me my pills, I go to my house, I take them, and I go to bed. If my life can be like it was, I'm fine. If not, then I will go to the doctor again and again and again and so on. But now patients are learning that we can take care of ourselves, and that is it in such a way up to us to be better or not. At least in here in mind. And the thing is, when you are in an event like this, or when you approach to a doctor or to a patient association, wherever, it doesn't matter. When you approach them and say, hi, I am a health activist, I am a blogger, I am a patient, they get like goosebumps, right? Because they're afraid from what we can say. They feel we are going to, I don't know, start saying a lot of crazy things about healing and mindfulness and reflection and going near to God, or I don't know. I just don't do anything special. I just try to teach people that instead of going to Dr. Google, they have to ask their doctors. It's something so easy, and it's something that most people don't know. Most people go to their doctors and they just give them a pill. And then in their homes is where they look for the internet to see what that pill is for, how to take it, and how bad it can do to them. They start getting frightened, they see those awful pictures, and they just don't take the medicine because of fear. And people like me just try to get them to ask the right answer, but the right time. Not at home when we are alone. Not to a person like me that is writing a blog, but that you really don't know. I have a blog, I write about lupus, I write about how I feel, but you don't really know me. What are you doing asking to me, what do you have to do with a lot of symptoms? You have 3-4 symptoms. Nuria, what do I do? You cannot ask a person you don't know what do you do with your life. You just go to hospital or you just go to your medical center, but you don't ask a person you just met on the internet and that you don't know. So asking the right question in the right time is what people like me try to teach other patients. Because if I go to my doctor with a set of questions written down, with a set of doubts, because everyone has doubts, if I go with that written down, that is what I say to everyone, then I will go out of the room feeling secure, because I have a conversation with my doctor. Now my doctor is not this high. We are like this equal. We talk about my treatment, we talk about the different choices I have, because we all have choices. no matter what. I can even choose not treating myself. And I'm in my right to not to treat myself. And I have to know it. And having the idea in mind that an expert patient is not that one that can, how does it say? I mean, we are empowered, but that doesn't give you the right to say that you want something and you want it right then. How do you say that? Exigir.
Yeah. To require, demand.
To demand. I mean, you cannot oblige the doctor to give you something. You can talk to him about what options you have. You can have a conversation. You have a debate if you want. But always knowing that the one that is the doctor is the one sitting right next to you or in front of you. But I don't really know what the doctors and societies are afraid about with we patients, because I think we can help a lot, and the most important thing we can help is accessing patients, because most of us don't usually talk. We are at home, alone, feeling alone, and thinking that we are the only ones, that no one will understand us. And we think always we are right when we go to the doctors, and they simply write down our symptoms, how our analyses are, and send us back home with more pills maybe, saying see you in 2 or more months. And no, I always say that we have to talk. My doctor have told me I need my uterus taken out. Why? Because I have lupus. Have you asked why? No? Just a simple question, why? Just a simple explanation. Not any explanation, but one explanation that I can understand as a patient, as a person. I'm no doctor. And they don't even know that they can keep asking until the doctor gets to explain things in a way that they can understand, and in the way that they can afterwards tell their family. And most of them come to me because they look to read things in a way that they can understand. They look for a place in which they read how they feel, which is what I did like 3 years ago. I was a patient like them. I just went to the room, got my pills, go back home, and stay alone. No one knew about my lupus and about anything that my lupus gave me, because lupus is not only an illness. It comes with depressions. It comes with no job, all in a sudden, with being 32. It comes with a lot of questions that have no answer, that want no answer, and that make you feel the only one. So people, they really feel safe, and they really feel more secure when they have something or someone that is accessing them without them wanting to be accessed. They just don't expect that. They just find a hand when they were looking for something desperate. When I'm done, tell me.
Yeah, it's okay. It's okay. You just.
I keep talking.
You have 1 minute.
Okay. So I think patients are important because we can give a lot of material, not only to patients, but also to doctors, to associations, to pharmacists, to industry, to everyone. Everyone is trying to help heal the patient, but where is the patient in all these events? Where is the patient in all the politics and in some of the new technology that is used nowadays, do we really count on them? Do we think they are important? Because I think we have a lot to say. It's just that maybe we don't talk in the same language you do, but maybe we have to put ourselves in the same level. And approaching them, we can then write down some needs that all of us, because at the end all of us are human beings. The only thing that makes it different is that I may have lupus, but we all are the same. We look for the same things in life, right? So I think we can connect the dots just if we have a bit of talk.
Thank you.